some of the testings are there, some of the analytical methods are there by which we can demonstrate that the product meets the bioequivalence criteria. All these tests are called as in vitro test for the bioequivalence. I welcome all the viewers to this informative video on in vitro testing for the bioequivalence. If you prove that the formulation shows or demonstrate the equivalence in vitro testing, then you can strongly demonstrate or prove the bioequivalence. As we know that bioequivalence may be demonstrated by the in vitro testing like BCS based behaviors based on the solubility, permeability and the dissolution. Some different tests are also there for demonstrating the bioequivalence by in vitro testing. Let's start with the video for the in vitro tests other than the dissolution for bioequivalence assessment. As we are aware about the dissolution testing to demonstrate the bioequivalence, many other tests are there which are other than the dissolution. Now, why the in vitro tests are used beyond the dissolution? Because only dissolution or alone dissolution may not prove or may not predict the bioequivalence. For some of the drugs like BCS class 2 drugs, BCS class 4 drugs, and for the complex formulations, because there may be the limited IVIVC. There are some in vitro tools which offer insights into solubility, permeability, absorption and more, which are related to the equivalence. So solubility studies are there, permeability studies are there and many others. So solubility studies involve evaluating the API solubility in various pH medias like pH 1.2, 4.5, 6.8. Some other medias may be used. Some biorelevant medias can be used like FASIP, FASIP to support the PCS classification, to support the solubility. And based on that, absorption potential can be demonstrated. Permeability assays are there which are used as the in vitro testing tools to demonstrate the equivalence. CACO2 cells are there. Positive intestinal or passive intestinal permeability studies are there, which if positive, then you can say that the permeability meets the criteria, and that's why you can demonstrate or support the bioequivalence requirements. Then supporting the BCS classification and predicting the in vivo transport based on the permeability assays can be done. Precipitation and supersaturation studies are there, which can evaluate the risk of drug precipitation in the intestinal fluids. These are generally considered essential for the amorphous type of formulations and for the supersaturating formulations. Dynamic gastrointestinal simulation models. These can be used as a tool to demonstrate the equivalency. USP apparatus 4, that is flow through cell, can be used to demonstrate the gastrointestinal simulation. Models can be developed and you can demonstrate the bioequivalence. Then simulating the GI pH, simulating the GI transit time and the media containing the bile salts, predicting the in vivo drug performance can be very useful for the demonstration of the bioequivalence. In vitro lipolysis testings are there for lipid based drug delivery systems, self emulsifying drug delivery systems. You can go through the demonstration of bioequivalence via in vitro lipolysis. Assessing the digestion and solubilization in simulated GI fluids. can prove the in vitro bioequivalence and can support the bioequivalence. In vitro in vivo correlation, that is IVIVC. It establishes the relationship between the in vitro dissolution and in vivo absorption. It supports bioequivalent scale-up and post-approval changes. It is suitable for both the type of formulation, whether it is the IR type of formulation, DR type of formulation, enteric type of formulation, or modified release type of formulations. Particle size distribution testing. It measures the API PSD and the PSD uniformity, influences the dissolution rate and the bioavailability. So by taking the testing like PSD, you can demonstrate the formulation will behave in the similar way. pH shift dissolution studies. These mimic the transition from gastric to intestinal pH, that is from acidic to neutral pH or basic pH, and it is useful for weak bases with pH dependent solubility. Then in vitro diffusion testing. It is generally used for the topical formulations. You can use the tools and methods or instruments like France diffusion cells to check the in vitro diffusion. You can go through the membrane use like synthetic membranes, and generally it is used for the topical transdermal and semi-solid formulations to show the IVIVC, to show the equivalence. Mucoadhesion and mucus penetration studies. These can be done to evaluate formulation adhesion and residence time on the mucosal surfaces. It is important tool for the buccal, vaginal, nasal and rectal dosage forms. These type of testings show the IVIVC for the mucoadhesion and penetration in the mucus. Rheological testing. It assesses the viscosity, thixotropy and flow properties, and generally it applies to the suspensions, gels and the emulsions. Also it applies to the topical formulations. GI transit and gastric emptying simulations. Different tools like BioGIT can be used to simulate the drug movement and mixing in the GI tract. It is useful for the narrow absorption window drugs. Powder flow and compaction testing. These are also sometimes tested for the formulations like tablets. PBPK modeling is a very important and is emerging a tool for IVIVC and to show the bioequivalence or to demonstrate the bioequivalence. Tools like Astroplus is there. Other tools are also there which can integrate in vitro data to simulate in vivo PK profiles. It enables virtual V assessment and formulation optimization. So many tools are there, many techniques are there by which you can show the bioequivalence, by which you can demonstrate the in vitro equivalence and correlate it with the in vivo equivalence. Many of the times the regulatory authorities accept this type of studies for different type of formulations, and if you need to show the equivalence in the in vitro testing in the early phase or early research phase, you need to do the studies. Then you need to finalize the methods, validate the methods and do it on the pivotal batches. So this is the information regarding in vitro testing or tests to show the bioequivalence. Thank you for watching the video, and we'll meet soon with such kind of informative video.